So recently I was at our Germantown location, and one of the PTs there was getting ready to have an evaluation with an individual who had bilateral patellar tendinopathy. And it had been expressed to the PT that the reason or the onset of the injury was a mid-30s to late 30s individual who had been relatively sedentary and then attempted to play a lot of basketball in one day, and the next day was waking up with both knees aching pretty bad. Went to the physician. They ruled out any structural damage and just classified it as an acute overuse injury and referred him out to PT. Now, with this individual, I think oftentimes we can oversimplify this to where we just say, oh, you know what? By the time they come in, they're going to be a week out or a week and a half out from the injury. Their symptom profile may be reduced. We may struggle to find a lot of impairments with this individual from a range of motion or for a strength standpoint, or maybe their strength is not, strength testing and activity testing is not as provocative as it was immediately after the surgery. And I know early in my career, I tended to write it off with a low sense of urgency, give them one or two stretches, and then say, hey, you know what, in a couple weeks, you're gonna be back to new. Just let me know if you need anything. We'll kind of keep your case open as is if you need to come back. And what ended up happening with those people is they'd be extremely appreciative of what I gave them. They would demonstrate in the clinic that they could do it well, and they'd go on their way, and 4 to 5 weeks later after I discharged them, they'd be back in. And the common theme that I found was they either weren't as diligent or as compliant with doing their home program as they were, but a large portion of them, even if they were diligent and compliant with them, I gave them things that were geared more towards just symptom management, or if I was giving them some strength and conditioning related activities, it was based off what their current level of status was at that time. And because we didn't know how they were going to tolerate it, it was difficult to really give them progression. So you had to give them a very conservative home program from a physical activity standpoint, and they would do it and they would be compliant with it, but then they'd go back and try to play basketball again or whatever that provocative incident was, and we never really bridged that gap back up to what their desired level of physical activity was. So one thing that I've found myself doing more and more, and I've had fewer incidences of people having re-aggravations of their injury and fewer incidences of people where I've closed out their case only to have to open it up again a few weeks later, a few months later, which if you're a PT or you work at the front desk, you know just the extra additional work that brings on. I've found myself treating after that initial evaluation and explaining it to the patient that your next 3 to 4 weeks in here is going to look like medically supervised exercise. And it should feel like every week you're just doing a progressive workout that's focusing more on higher level mobility training, higher level strength training, and reintroduction of impact activities, running, jumping, some multi-directional work in this scenario. But it should almost feel like you're coming into a personal training or group training environment, but you're doing so under the notion that you know you're being guided and supervised by somebody that's putting guardrails on your activity. So you can come in here and you can put in a high level of effort with the activities that we're giving you, because you know session by session and week by week, we're not going to let you exceed what you're capable of doing. And approaching it that way, it tends to be very well perceived by the patient. In this case, where the evaluation that was coming up, where you have somebody that was a sedentary individual, they tend to love that because they say, you know what, I've been sedentary, I want to get active again. I've always just been hesitant to do it because I feel like I always get hurt, or I feel like I don't know what to do. And these tend to be the people that they are really fun to work with because you just get to act almost as like their workout partner, taking them through everything. But on the back end, you know that you're using your physical therapy knowledge and your kind of medical health wellness background to put guardrails and parameters on their workouts so that that client and that patient can work out at a high level, get a good session in, but not have to worry in the back of their mind if they're going to injure themselves. Then you start giving them a little bit more week by week that they can do outside of the clinic. And before you know it, when you get 3 or 4 weeks out with this individual, you've gotten to see them 6, 7, 8 times. They've had a month of structured physical activity with you. Their mindset changes, their physicality changes, their style sometimes starts to change for a more active route, and they're getting back to all those things that they used to do and love. And really all that it took was just some intentional exercise programming and you really conveying to them what the value of physical therapy is with them getting back to an active lifestyle.